In the name of Allah, the most merciful and the most gracious. We are doing chapter number 14, respiration, and the topic that we will discuss today is respiratory disorders. The disorders which are related to the parts of the respiratory system, for example, lungs. We will talk about the upper respiratory tract infection first. Its infection includes sinusitis. Sinusitis is the inflammation or swelling of the area which is lining sinuses. Sinuses are the connective system of hollow tubes which are present in our skull. If we see in the diagram, here is the frontal sinuses, sphenoid sinuses, the maxillary sinuses, and the line that is separating both the sides, or you can say both the nasal cavities, is called septum. As we said that healthy sinuses are the hollow cavities which are filled with air, but the diseased ones are filled with some fluid in which the bacteria, viruses or fungi can grow when we inhale air or dust from the surroundings, and they may block the sinuses, which causes sinusitis. Sinusitis consists of two types, acute one and the chronic one. Acute sinusitis, it lasts for 2 to 3 weeks, and the chronic one lasts much longer. Now if we talk about the causes of sinusitis are cold and wet climate, some dental infection, atmospheric pollution, overcrowding, smoke, and viral infections. Now, what is the acute sinusitis? Acute one is a sudden onset of cold-like symptoms in which we observe stuffy nose and facial pain. It lasts for about 4 weeks. There is another type of sinusitis, that is subacute sinusitis. This inflammation lasts for 4 to 8 weeks. The chronic one, if we talk about chronic sinusitis, it is characterized by severe inflammation. And the fourth one is recurrent sinusitis. It may attack several times within a year. Here, the symptoms I am going to repeat are the fever, nasal obstruction, raspy voice, pus-like nasal discharge, loss of sense of smell, facial pain or headache. What are the treatments of sinusitis? As we have talked that it is because of a bacterial infection, viral infection, or maybe of fungal infection, so antibiotics are usually used to treat this disease. Another means is the nebulization, which can be useful in reducing inflammation in the sinuses to accelerate recovery. Now we will discuss the lower respiratory tract infection, and its infection includes pulmonary tuberculosis. Tuberculosis is proved to cause 1 million cases per year. instead of a good health available. Tuberculosis, commonly known as TB, is an airborne infectious disease. Tuberculosis mostly affects the lung tissues, and its causative agent is Mycobacterium tuberculosis. Mycobacterium is strictly aerobic bacterium. That is why it is found in your lungs, and the symptoms are low-grade intermittent fever, night sweats, weight loss, depression, dry cough with sputum, dull ache in the pleural membranes. The Mycobacterium is strict aerobic bacterium, and in this disease the immune response is in the form of cell-mediated immunity, means the antibodies are not produced here to eradicate the pathogen. Rather, different types of macrophages, which are the cells present in the lungs, are here to eradicate the pathogen. First of all, the primary infection will occur that consists of three phases: the elimination phase, the retention phase, and the active phase. In the elimination phase, the bacterium may become eradicated from the lungs when the macrophages will surround the bacterium and will remove them from your body. In the retention phase, macrophages would surround the mycobacterium. It will stay inside your lungs but will not cause the disease. But in the active phase, the lungs will be destroyed as the mycobacterium would grow to a dangerous extent. You can see the mycobacterium that can spread from the droplets of a cough or a sneeze by an infected person. Now, the treatment of tuberculosis: daily observed treatment that is of short courses is given. It is called DOTS. The treatment is given to the patients under supervision to ensure that medicine intake completely cures the patient. So if the immune response is strong, we can get rid of the mycobacterium that has entered into the body. Disorders of the lungs. What are the lung disorders? It includes lung cancer. Cancer is a malignant tumor which may be developed due to the uncontrolled cell division. Uncontrolled cell division, we have read this in the mitosis, in which the cells would not grow normally but uncontrollably and would form the masses or the calyces. The causes of lung cancer are smoking. Smoking contains the carcinogenic agents which are cancer-causing agents, which includes carbon monoxide, tar, and other components. Radiation such as gamma and X-rays, they may also cause the induction of the cancer. Some compounds in the car exhaust fumes are also examples of carcinogens. Now, what are the symptoms of lung cancer? You can see the growth of the calyces or masses inside the bronchi. The tumor may grow until the bronchus is blocked. Thickening and callousing of the cells lining the bronchi. Bronchi, are the small tubes which extends from the trachea, and the loss of cilia in the tracheal tubes or in the bronchi. Now, what are the treatments of lung cancer? Pneumonectomy, that is the surgery in which the part of bronchus is cut down which has tumor in it. Chemotherapy and radiotherapy are two other ways of the treatment of lung cancer. Now the last topic of the chapter is effects of smoking. There are different effects of the smoking. 87% of the lung cancer is caused by cigarette smoke. Cigarette smoking is also a major cause of cancer of the mouth, larynx and esophagus. Cigarette smoking causes other lung diseases, that is chronic bronchitis, emphysema, which are the diseases of the alveoli. Cigarette smokes contain chemicals which irritate the air passages and lungs, causing early morning cough. Smokers are likely to get pneumonia because damaged or destroyed cilia cannot protect the lungs from bacteria and viruses that are floating in the air. Smoking can make it hard to breathe. Within a short time, it can also worsen asthma and different types of allergies. Thank you.